Hello everyone, I am Shalini doing third year videos in Chettinad Dental College. Let's talk about trigeminal neuralgia. Content: Anatomy of trigeminal nerve, definition, clinical characteristic, causes, etiology, pathogenesis, types, diagnosis, differential diagnosis, and treatment. First, see about anatomy of trigeminal nerve. Trigeminal nerve is fifth cranial nerve. It is responsible for sensation in face and certain motor function such as biting and chewing. Three major branches are ophthalmic nerve, maxillary nerve, and mandibular nerve. Next, see about definition. Trigeminal neuralgia is a neuropathic disorder characteristic by episode of intensive pain in the face originating from the trigeminal nerve. It is another name also called as tic douloureux, trifacial neuralgia, fourth is Gill's disease. Next, let's see about the clinical presentation of trigeminal neuralgia. In the early stage, the pain of trigeminal neuralgia may be rather mild and it's often described by the patient as tingling, dull-ache and burning sensation. This clinical presentation may be erroneously attributed to the disorder of the teeth, jaws and parasinal sinus and leads to escalation of the treatment and the variety of therapeutic misadventure. Trigger zone. Some patients are sensitive in certain area of the face which when touched cause an attack of pain. Let's see in this image. Most commonly are located on the cheek, lip, nose or buccal mucosa. Next, causes of the trigeminal neuralgia. Main causes is the damage to nerve leading to demineralization of nerve and finally leading to the stabbing, severe shock-like pain resulting in the neuralgia. Factors causes damage are old age, infection, multiple sclerosis, pressure on nerves and diabetics. Next, pathogenesis. Compression of the blood vessels, especially the superior cerebral artery, and it goes to chronic irritation of the trigeminal nerve at the root entry zones, which is increasing firing of the afferent or sensory nerve, which leads to trigeminal neuralgia. Next, let's see about the clinical features of the trigeminal neuralgia. Female is most commonly affected than the male. Age group 50 to 60 years. Incident 4.3 per on lakh. Distribution of the pain. Localized to trigeminal nerve, 80% maxillary and mandibular combination. Right side is most commonly affected than the left side. Clinical examination. Usually normal. See in this picture, nerve involvement maxillary 60%, mandibular 49%, ophthalmic 16%, all three division or 1%. Let's see about the diagnosis. The diagnosis of TD is based almost exclusively on the history and CT scan, MRI also useful. Next, differential diagnosis. Migraine, sinusitis, dental pain, post-hepatic neuralgia, tumor of nasopharynx, cerebral anorexis. Next, treatment. Peripheral neurectomy. In medicine, phenytoin, carbamazepine, microsurgical decompression of the trigeminal root, injection of boiling water in the gastric ganglion. Next, surgical. Microvascular decompression, pericutaneous balloon compression, pericutaneous glycerin exectomy, pericutaneous radiofrequency exectomy. And finally, I conclude that trigeminal neuralgia is a profoundly impactful condition characteristic by the severe and intermittent facial pain, Through our exploration today, we have gained a deeper understanding of its causes, symptoms, and last advancement in treatment option. Let us continue to raise awareness, support those in need, and remain hopefully that with persistence and compassion, we can turn the tide against trigeminal neuralgia. Thank you for your attention and commitments to this important causes. Thank you.